I am Rosalia Joseph, the PAMCA Woman in Vector Control Regional Coordinator for Central and Southern Africa. And I'm also joined by Dr. Nzoma Shimapanda Mata, who will be co-hosting the webinar with me. So it is both an honor and a pleasure to introduce our esteemed speakers. I would like it if they can please put on their videos so the audience can see who the speakers are. So we have Professor Nkandu from Zambia. And then we have Ms. Gillian Malatje from South Africa. And then we'll also have Dr. Elizabeth Bandason from Malawi. Well, just to give a brief overview of today's webinar, through this webinar, we will have the privilege to delve into the experiences and perspectives of women in Southern Africa who are leading the way in public health and the control of vector-borne diseases. They will share their professional journeys, providing an invaluable platform for interactive discussions that aim to inspire, educate, and foster collaboration among emerging and the established professionals in the field as well. So today's discussions are very crucial in highlighting the significant role that women's representation and active engagement in public health and science at large has, and that is through collective and concerted efforts, and also just to show how we can support one another. So without further ado, we should get right into the talks from the speakers. Dr. Nzoma, over to you.
Thank you very much, Ms. Rosalia. Do we have Dr. Emma? Not yet? Okay. Thank you very much. So we'll go right away into the first presentation. And our speaker is Professor Nkandu, and she's speaking to us on the topic, Gender Roles and Global Health. How can we marry African culture with women leadership in the African continent? Gender roles and global health. How can we marry African culture with women leadership in our continent? Professor Nkandu is a microbiologist. She's a politician. She's a former Minister of Health as well as Education here in Zambia. And she has vast experience in leadership. So we invite her to speak particularly on the aspect of global health, women, and culture. You're welcome, Professor.
Thank you. Thank you very much. And I want to thank you for giving me this opportunity to be part of this global discussion on as we celebrate women in science. I'll start by discussing the global health and gender, how we can achieve better health outcomes for vulnerable populations, such as women and communities in the world, how we can eliminate health disparities globally through research, education, collaborative interventions. And I'll end by talking about when women lead, and I'll give some examples as my story. And just to put this in perspective, what distinguishes global health from public health, because now there's a lot of talk on global health and let's talk on public health. Public health per se emphasizes a broad multidisciplinary approach to dealing with emerging health challenges. While global health is much broader, it considers not only emerging health challenges, but looks at social, cultural, economic, and environmental factors that underlie health inequities such as gender disparities. And global health promotes a transformative approach to gender and health. And the instruments that are used are research, policy and practice, collaboration across disciplines, faculties, and a variety of external partners work on global health. Now, when you look at the topics of research that are always considered when you're looking at global health and gender, usually you look at topics such as effects of gender-based violence on health. There's a lot of work around policy analysis and the environment to address gender-driven risks, especially of non-communicable diseases, like, for example, the health that's associated with gender-based violence. There is a lot of analysis of the history of gender in global health policies and programs. Global health has been looking at how best to interact with gender. And you cannot talk global health unless you are talking about STEM. And although of late, when you are talking to girls, there are more girls that are taking up science, but still there are very few that are engaged in research. And as I said earlier, it's important to not only talk about global health without really emphasizing research. And again, gender disparities remain, and I'll show this in a minute. When you actually stratify on numbers, you find that only 30% of girls are in science fields on the African continent. Why is this so? That's where the title of Marine Science and Culture, Global Health and Culture, becomes important. Is because women are underrepresented because of tradition and cultures. And this starts very early in life. You find that when you go to schools, primary level, you find as many girls and as many boys in a classroom. But as you start getting to secondary education, especially at tertiary level in the universities, you find that the number of girls that enter universities are 5 times lower for girls than for boys. There are more boys in universities than there are girls. And there are more boys taking up science fields than there are girls, because it's believed that these science professions are for men. And more challenges actually face girls and women. It's the policy environment in our various countries which actually reduce the participation of girls and women in research and the science field, because our policies have not prioritized the participation of women. And some of our traditions and cultures and society norms in our societies usually shape our lives. For example, they choose which subjects, which jobs the girls can be. Girls can be teachers, girls can be nurses, but they do not look at the hard science that the women can also participate. And women are also the primary caregivers. So instead of just focusing on school, they are also given chores where they are looking after the elderly, looking after the children, and this keeps a lot of them out of school. Girls are also seen as tools for people to get rich. So you find that a lot of girls are sent into early marriages and child marriages. And in cases where those scientists that actually excel and get into university, and maybe they are required to go and travel somewhere to improve their careers, women do not normally benefit from such opportunities because they have family responsibilities, such as the pregnancies because they are housewives or they are breastfeeding. And this has actually caused a lot of women not to move forward and excel. But I think what is also important that we don't pay attention to is that we have very few role models where young girls can look up to and say, I would like to be like that person, where they're very, very few. Now, it is very important as we look at all these cultures, all these traditions, society norms that have made it difficult for girls and women to excel, that we also look at women that have excelled. And I think that is the story for today, when women lead. But it's important to know that globally, policies and movements have made it possible to reduce and overcome certain gender barriers. But in Africa, the women that have made it, it's true to say they've pioneered their own success. Even at workplaces, women have to try extra hard to achieve. And I know so many women that have taken up STEM and have succeeded. And there are so many women that have led in various fields and have succeeded. I'll start to tell my own story, that I'm one of the people that actually in the beginning of my lifetime, I thought I would be a most brilliant lawyer. But my parents insisted that I took up science. And I was able to succeed, qualify, even specialize as a microbiologist, but even further, subspecialize as an immunologist. And I was the first ever microbiologist in Zambia and first ever immunologist in Zambia. And I took up this seriously. What also worked on my side is that as I was coming back as a young immunologist, came the epidemic, HIV and AIDS. And I was amongst the 4 doctors that identified the first case of HIV, because I was given a patient and say, as a young immunologist, tell us what is wrong with this patient. But I took up this fight of HIV very, very seriously. Apart from just identifying, I was able to mobilize money, which came and set up the first ever response to HIV and AIDS here in Zambia. When you read about HIV AIDS response, you read about the short-term plan that saw the establishment of 33 blood screen centers across Zambia to ensure that all the blood that was being tested was safe. I even went on further to set up a program that ensured the safe blood transfusion in the country and set up what, if you like, is known as the National Blood Transfusion Service. And not only for Zambia, but I was also given the leadership by the Commonwealth office in Arusha to also mobilize in the SADC region. So I traveled to Namibia, traveled to Botswana, traveled to Mauritius, everywhere, Tanzania, trying to help governments to set up this. I didn't end there. I mobilized money to also set up counseling and testing services around the country. And eventually I was able to argue that HIV cannot be done by one ministry called health, because it has social implications. And we set up what today is known as the National AIDS Council. So if you like, the entire HIV AIDS response, if you read about it, has my hands. I set up research responses like the Zambad project and many other programs, and also led 2 very important civil society organization, Tacinta, that mobilized sex workers and gives them alternative, and also Society for Women and AIDS in Zambia that supports women and children that are infected and affected by HIV. That's one leadership that I think as a woman, I worked with a lot of collaborators, a lot of people. The second one was when I was Minister of Health, we had a bubonic plague in Zambia. And I was able to show that no one individual can deal with an epidemic. I put up a team of historians, scientists, microbiologists, parasitologists, public health experts, and so on. And we moved into Mumbwa, where this epidemic was. Believe it or not, within 1 week, this epidemic was eradicated. And I recall the international world sending a group from France, Médecins Sans Frontières. When they landed at the airport in Lusaka, all they could say was shake their heads that they've never seen anything like this before, where an epidemic is eradicated within a week. At the time I was Minister of Health, this is the third example I can give, I was also faced with a cholera epidemic. And when I look at what is happening in Zambia now, where the epidemic has been going on for a long time, has even spread to the rest of the country, I led a team as Minister of Health where I made sure all the key ministries, key sectors, civil society, we all came together every day at 7 o'clock. We planned and moved in, and we were able to make sure that those that are experts in sanitation focused on moving from community to community, putting EnviroPure, which is a chemical that biodegrades feces, and so that the feces all went down. And then we made sure that every household put a lid on their toilets. And we then started a chlorine project and started producing chlorine and distributed it household by household. And we also got the people that were experts in water to ensure that all the places where they had shallow wells, boreholes, they were told to stop and use clean piped water. And the local government that was responsible for making sure that there's no street vending on the streets were given the assignment to ensure that street vending was brought to the minimum. And we were able to convince people on the street, not forcing them out of the street, by showing them studies that we had quickly done, because you cannot fight an epidemic without data. We were able to show that the transmission was coming from people that are selling food in places where there are no toilets, and without washing hands, they were transmitting from one person to another. And when people were convinced, they were ready to leave the street. And we were able to stop the cholera epidemic within weeks. And even when you go back and look at the death toll, we had very minimal death toll in Zambia during the cholera epidemic. And again, it's important when women lead, they see that they have to work with other people. And unless you are able to work with other people and just provide your scientific leadership, your policy leadership, you'll find that you'll be battling with something that you can stop within a very short period. So, colleagues, I want to say that in recommending the way forward, we need to close the gap in sub-Saharan Africa between men and women. And we need to start celebrating ourselves. And I want to commend you today for celebrating this Science Day by having this webinar so that we can start sharing our stories. We need to get men to start perceiving women as intellectual equals. And this will call for policy shift, and this will enable African women to play a more prominent role in science and global health. We need to promote the concept of role models in science, and we need to campaign against child marriage and early marriages. So I want to conclude by saying, let us celebrate ourselves. There are many, many women in Africa who have done great things. Maybe this is time when we should write a book. Maybe this is time we should work with the people in the film industry to start telling our stories so that the future will be brighter for their young girls. They'll be attracted to join science because they are seeing the impact that one is making in science. So I want to take this opportunity to thank you all for listening to me. Thank you very much.
Well, thank you very much, Professor Lua, for sharing your experiences and insights into gender and global health. I'm pretty sure that the audience cannot wait to interact with you during our Q&A session. So please allow me now to call on Mrs. Gillian Malatje to give her presentation.
Thank you very much, Rosalia, and let me observe all protocols, and I believe that you will be projecting from your side.
Just a
Yes,
moment.
I have been requested to talk to leadership, the do's and don'ts in malaria control, and I will be covering the do's and don'ts, but also just to marry the different terms of leadership. So there are many descriptions of leadership that I believe we have, but I wanted to just talk to the concept of why it's important for women to be leaders. So leadership involves motivation and it involves influence, wherein you get people to willingly relate to your task and to obtain a certain desired goal. So as women, we know very well that we are very brave, we are focused, we are empathetic, but moreover, we are multitasking. We will be cooking, cleaning, having babies on our back, doing our work, and we are able to even strike a very balanced life because we are considered to be the backbone of a progressing nation. So it is very imperative for women to be in leadership positions, more especially because we know that there are gender disparities, there are gender inequalities, and again, there are misconceptions and stereotypes when coming to women in leadership. And when coming to malaria control, we know for years that malaria elimination or malaria control programs, they have been very well male-dominated. We are seeing a change now, but I think we still need to strive forward to make sure that women are represented when coming to leadership in malaria. More especially because our call for leadership as women will be used to raise our voice and again to show our skills and knowledge and also advance people because we know that we are the primary healthcare givers. So I wanted to just make a summary of the do's of leadership by looking at one of them very motivational model by a very famous lady who I relate to very much, just to share my experience. Because when you come to leadership, there are always issues of perception when you are a woman. You will be judged on whether you are capable enough. Can you do the work? Are you going to be able to deliver? I remember there was a situation where I was even asked whether me wearing heels to work is going to impede on me delivering on the attainment of the malaria elimination goal. But moreover, there is always expectations. Some, they are reasonable expectations, some they are not reasonable, but we always thrive because at the end of the day, I think my overall experience led to performance adjustment and also adaptability. Though it started on a very rocky slate, but eventually you build relations, you are able to consult. And like I said, it's like a roller coaster. It's not constant, it's having its ups and downs when you are leading as a woman. But I think it's generic for leadership. You have those moments wherein you are achieving, you are performing. When you start, it's rocky, but you adjust within the system and you adjust within the teams and the work relations that you are building. The other challenges that I face is that for as much as you are striving, you are having good plans, you are having finances, you are having stakeholder relations, there is also issues of process weaknesses that you are going to be able to, you will be facing. There is issues of labor relations. And as you know, I think in several countries, malaria control programs are a siloed or a parallel program. So you will also face that and also inadequacy of data. And you have to continuously work within those challenges so that at the end of the day, as a leader, you obtain shared vision, there is performance, and also issues of mindset change. You are able to collaborate and integrate with every intervention that you are developing, and you are enabling sustainability. Whether you are there or not there, you know that you have created a system that is well-oiled and that is very proactive, and people can be able to do early diagnosis and intervention. I think to just summarize the key components or the key do's, when coming to leadership from my experience, I will refer to Marian Temen's leadership model. In her leadership model, she relates leadership as a similar to conducting an orchestra, where she indicates that you have to have the correct tune for you to be a leader. You need to conduct and lead. You need to guide. You need to invest so that at the end of the day, whatever song that you are going to produce, people can relate to it, people can enjoy it, and people can buy into it. So Marian Temen's model just indicate that as a leader, you need to be able to coordinate. You need to serve with purpose. You need to have knowledge and also teamwork and other be cohesive and also acknowledge diversity. So some of the very key components of leadership in summary, hence I've already indicated that leadership is having a lot of components, is that as a leader, you must be able to be progressive. You must lead with purpose. You must be a visionary, which is very important because you are driving and leading people. You must be a system thinker. You must be able to plan. You must be able to organize, to execute your plan. And in the different systems that you find, you must be able to interconnect them. You must also cultivate growth mentality. You must be a team worker and be able to motivate people so that they can change, so that they can be developed. The other element is that you must be able to master the art of communication. You must be aware, who do you need to communicate with as a woman in leadership? When do you need to communicate? How do you need to communicate? What and where do you need to communicate? You must also be able to collaborate and also integrate. Be passionate about your work, but also be compassionate about your people. The people that you are leading, you must be able to care about them. You must be accessible and consultative. And again, thrive for success while you are doing the whole human resource management relations and also management. It is very key because if you don't have relations with your team or the people that you are leading, at the end of the day, they will be lost, they will be misguided, and they will be frustrated. So I think those were the summaries of the do's when coming to leadership. Now I will talk to the don'ts. With the don'ts, I will just give a summary of things that usually lead to bad leadership. When people are feeling suffocated, when people are feeling extremely tired, when people are feeling like they are being kicked to the curb. There is poor planning, everything is just messy, people are confused, they are not having direction, they come to you, they walk as if they are working on eggshells. That is not good leadership. And I think just to indicate some of the key elements that are described in this picture here is that when it comes to leadership, you don't have to do the following. You don't have to suffocate or micromanage people. You don't have to limit people. You need to let people as a leader to grow, to spread their wings so that they can be able to be innovative. You need to limit biases, discrimination, whether it's gender, whether it's age, whether it's qualification, whether it's race, you need to limit that. Favoritism, we always hear about favoritism challenges in the workplace. As a women leader, you need to limit that. Lack of awareness, starting with self-awareness. You need to be aware of the things that are happening and not be resistant, accommodate change. You don't need to be autocratic or intimidating. Just because you are a woman leader, you don't need to be, it's either my way or the highway. You need to even not take credit for everything. You need to recognize effort. People who are doing it, people who are team players and making efforts to deliver, you need to recognize them. You don't need to ignore, judge, dismiss, undermine, and overpower your team members or the people that you are leading. Poor communication, poor listening, poor interest, poor speech, people will feel neglected. And at the end of the day, they will take decisions that are not beneficial to your goal. Making uninformed and unwarranted decisions. As women in leadership, we need to consistently and continuously research. We need to be informed before we make decisions. Lacking accountability and ownership. As a woman leader, whatever effort that you put through, you need to account for it. Being it an achievement or being it a setback, you need to account and own up to it. We need to not create resistance, division, and toxicity. We must not be divisive leaders. We need to allow we do not need to allow divisions within the programs that we will be leading, and we do not need to allow victim mentality. If we fail, it's because we failed because we were doing the work. We did not fail because we are women. So we must even own up to things that are not going right, but also celebrate things that are going right. In my conclusion, I will just indicate few speakers that or influential people and what they have quoted as far as feminism and women leadership is concerned. Selina, I liked her word. She said that feminism is not accepting discrimination or bias as a blocker to success, but recognizing it, overcoming it, and becoming better and stronger because of it. And then Oprah Winfrey indicated that the world's most prominent women leaders show the importance of honesty, of courage, impact, and decisive action in leadership. So as I conclude, I would like to indicate that in the future, there mustn't be an indication that there is female leaders. There must be indication that there are leaders in the world, because women and men, they will be leading equally. I would like to acknowledge Pamka for the invitation, and Professor Kukemur from Wits University, who recommended me to be part of this talk, and also the malaria control program in Mpumalanga that has been giving me support to lead them over the years, but also to just conclude this talk, this important global platform talk, to indicate that in future, we believe that leadership will lay a very delicate hand for women. Although some may resist, it will change eventually. And we encourage you, I encourage you to push through all the barriers of gender disparities, because in the future, women will be leaders and their efforts will be recognized. Thank you very much.
Thank you very much, Ms. Gillian. We greatly appreciate the presentation and the insights. And before I call upon our next presenter, I just want to remind you, our esteemed participants, that we have a Q&A section in this Zoom. Please take down your questions and feel free to post them in that section. Soon after the last presenter, we are going to tackle those questions. Our presenters are going to take the questions. So please, you're welcome, and we are happy to have you. So our third presenter is Dr. Elizabeth Bandason from Malawi. She's presenting to us the topic, Women Mentorship and Capacity Building in Science. Women Mentorship and Capacity Building in Science. She has worked a lot with the NMCP, the National Malaria Control Programs, and she has done a lot of research work. Dr. Elizabeth, you are welcome.
Thank you so much, Dr. Nzoma. I would kindly suggest that you please display my slides, please.
Doc, it's displaying. Can you see it from your end?
No, I can see the ones that has just finished. I can't see them yet.
Oh no, I'm actually projecting your slides.
No,
Yeah, on my end. Yeah,
Rosalia, we are only seeing the past speakers' slides.
Really?
that's true.
Let me just capacity building. Okay. What do I do?
You can stop sharing, then start.
All right.
Thank you. Our Q&A section has become active. Please keep it active through the next presentation. Thank you.
Doc, are you able to see your slides now?
Yes, I'm able to see them. Thank you.
For the inconvenience.
It's all right. So thank you so much, Women in Vector Control, PAMCA, and everybody that is attending this webinar. I'm honored to be part of the presenters and to talk about something I'm really passionate about, women and mentorship and also capacity building. I'm Elizabeth Bandason from Lilongwe University of Agriculture and Natural Resources. That's where I'm based, but I work with several other institutes. I think that I will talk about in the process as I give you a talk on women mentorship and capacity building in science. So yeah, so just a brief overview. The slide you saw earlier is just me and some young girls at Bunda and LUANAR. We just finished the session where I was teaching them what it means to be a woman of purpose and have what we call a purpose roadmap. And this purpose roadmap, I'm going to talk about it quickly, but I've done quite a lot of this across the country, but I've done it mostly at LUANAR, at Bunda where I'm based, and several other places. So this was just one session that's way back, I think in 2016-17. And so I would want to take you through what mentorship is, and so that we understand, all of us, what it means to be a mentor and what it means to be a mentee. So who is a mentor? So a mentor is someone who would provide guidance to beginners or experienced individuals in the areas of expertise, in which other areas that you're doing in science. Sometimes your mentor can be someone who is outside your area of expertise, depending on your needs. So the mentors usually provide training, they'll give you leadership, they'll lead you into things that would make you to become a better version of yourself. I want to say it in advance that your mentor is not necessarily your supervisor, and your mentor is not your therapist, and your mentor is also not a sponsor. And most of us, we usually find it difficult to differentiate between these three. A mentor is someone who is completely different. And remember, like I've said, underline the word guidance. It's someone who provides guidance for you to get to be the best version of yourself. In what way? You know the areas that you need mentorship on, or maybe you need holistic mentorship. It's up to you. So mentor can be someone who is your peer. I have benefited a lot from my peer mentors. I have a friend who is always checking on me, and she acts like a policewoman to find out how I'm doing some of the things. So that's my peer mentor. You can also have a mentor that can be formal and informal. Some of you would be lucky that somebody would just like the way you do things. Maybe they can see your potential, but which you yourself don't see. They'll informally mentor you. But you can also enter into a formal mentorship agreement where you actually write down your goals and your objectives, mid-term, short-term, long-term. You write an agreement and you set up meetings every month or every week, depending on your needs and what you want to do. And that's something that I would strongly recommend, to have a formal mentorship program or a formal mentorship relationship if you want one. When you have a mentor, if you have one already, or if you're considering to have a mentor, also consider having a sponsor. A sponsor is someone who is going to talk for you in tables where you're not sitting, someone who understands your work and someone who can actually promote your work, someone who's aware of your skills, and someone who can actually tell people what you're good at. And so you really have to make a distinction between a mentor and a sponsor. But both of these are very important in your career if you're building a career in science, or if you want to build capacity in others. So what is the role of mentorship in science? Do we need mentors in science? And how does this relate in building capacity for women scientists? I think mentorship, or being mentored, is one of the best gifts you'd ever get as a woman scientist, because you're either getting knowledge from someone who is really experienced, or if you're a mentor, you're passing knowledge and creativity from one generation to the next. If you are a mentee, you will agree with me, if you've gone through this process of mentoring or being mentored, it increases your confidence and creativity. And if you are a mentor, it also increases your confidence and creativity, because you're always put in check to make sure that your mentee is doing what they have promised or what they've promised that they want to do, but also holding themselves accountable to that. But one thing that I really about mentorship or being mentored is that it opens up your mind to do science that you'd really go against odds. Something that people don't believe in that would be done has actually been possible because somebody somewhere has sat on the table and told you that you can do this and you can do it better than I did. So it also has a multiplication effect. In Malawi, there are very few entomologists, like very, very, very few. And I can actually count how many women are in vector control in Malawi. Now, if you are the only woman, like, or one or two out of 50 men, for example, which are not even 50, you are in this vector control area and you are alone, you'll be faced with a challenge where you have to do everything by yourself. And believe you me, it becomes overwhelming. The best success story you ever tell of yourself is when you're able to replicate yourself and replicate a better version of you. So if somebody has been trained by you, you should look at producing someone who can do things better than you used to do them. What that does is that it takes off some of the responsibilities that you should have been doing as somebody who is looking all over and moving all over the country, getting overwhelmed, not taking care of yourself because you believe that you can do everything by yourself. No, but when you are able to mentor others and build the capacity in them, you have a multiplication effect. Your tasks are easier, but also the impact of the science you do grows bigger, and you can actually see how it benefits other people at the end, not just you sitting all by yourself and doing all the research work by yourself. It does get overwhelming and it doesn't get productive. But more importantly, we also have to acknowledge that we will not be sitting in these chairs we sit in or in these positions we're sitting in forever. We will need to be in a space where we can handle our mantle to someone who can continue our vision, in addition to the vision that they have in making the spaces we work in making the science we do better, and making the science we do groundbreaking to face the challenges that we are always facing as humans on the planet, more especially as regards to science and vector control. So mentorship, one thing that I think everyone should engage in for is because of the multiplication effect, but it also opens your mind to dare the odds, not to be afraid to do things that others have said it's impossible. So I want to talk briefly about my journey and how I got myself introduced to something something to do with mentoring or being mentored. In 2011, I sat in a space somewhere in Kenya under a program called Award. This was an agriculture program, but I found myself there because I was so interested in the healthy aspect of the farmer. I work a lot on insecticides and mosquitoes and insects. So I got so much concerned of how much as human beings we are consuming insecticides and how much a farmer is exposed to malaria and everything that makes a farmer a complete person. So I sat in Kenya under 3 people in 2011, where I was asked to choose a mentor, and they made a formal mentorship agreement. And I was lucky that apart from having a mentor, I was introduced to a coach. But one thing that happened to me that day, and I still remember the place, was at Jacaranda Hotel. I was taught to draw what we call a life purpose roadmap. So when I sat on that table, I was asked that you're a scientist, you're doing all this work, so what? What does this mean? Where does this get you? If I meet you in 10, 15, 20 years from now, what kind of a scientist will I be looking at? And how do you get there where you're going? And what do you need to do? Which people do you need to meet? What meetings do you need to attend? Which courses, which PhD, which masters do you have to do to get where you're getting to? So this kind of opened my eyes because it didn't just come as a personal development plan that most people talk about. This became a life purpose. So I had to look into my science, not as just something that I'm doing to bring food on my table or that I like, but something that would really, that if I look back in time, somebody would say, well, Elizabeth was once here, she discovered this, it helped somebody to do this, and this is how we're living better because this woman worked tirelessly so that we can get to live the life we live. And one thing that really woke me up on this journey was There was one statement somebody said that every 60 seconds, then we lost a child to malaria in Malawi. So this statement used to keep me jumping out of my bed. Every time I want to sleep, I'm remembering that although I'm sleeping, although I'm playing, although I'm doing all these things, there is somebody who is dying out there, and I could do something just to change, or not to change, but to contribute to that. So there's a difference between a career development plan and a purpose roadmap. One is about why, and the other one is about what. Your career development plan is what do you want to do. Your purpose roadmap will constantly ask you why you're doing what you're doing. And you can update that every day and every year as you go. So after going through this being mentored journey, I became a mentor in 2013, where now I had to take up other young women whom have also developed their life purpose roadmaps. If you want, I can share them later after this. And they had to draw their journey in 10, 15 years ahead of time. And we mapped it out and see how that has gone. And every now and then we check each other to see where they are. The next slide, please. So through this life purpose roadmap, I got to learn that everywhere I go, every workshop I do, every institution I visit, I needed to zoom my lens to see who in this institution, who in this setup will help me become the person I've told myself I'll be in 2030, for example. So I found myself in spaces like the University of Malawi, who has produced me, Michigan State University. When I was going to Michigan State University to do my PhD, I didn't just choose it. It was one of the least paying PhDs I've ever done. But what I chose it for was because of the knowledge and the person that I really wanted to work with and how that gets me to where I want to go. And through this, mentoring and mentorship programs, I've had an opportunity to meet and work with people from Liverpool School of Tropical Medicine, who I still work with, the World Academy of Sciences, and several other institutions, International Science Council. And right now, I'm working with PMI Evolve, looking at malaria control and entomological monitoring in Malawi as the whole country. And I've started this project just this month. And then through them, because then by being a mentor and being a mentee, I learned what I want to do and where I want to be and who I want to talk to. I had to make selective networks and have selective people that I want to talk to. That leads to me achieving the purpose that I have. So this is just something that I want us as women scientists to have. Our lens, our eyes should zoom brighter and deeper to see and to look deeper into what's good in everything that we do, in the people that we meet. We have a tendency of taking people at face value, but trust you me, every person you meet, anyone you sit next to at a conference has something that you have to learn from. So develop those lenses to see that, okay, if I've met Elizabeth today, if I've met Rosaria today, what is it that I can learn from Rosaria that I do not have? That will only come if you have emotional intelligence, you're self-aware, and you also admit some of the weaknesses that you have as a scientist that you want to build by learning from what other people have done. So you have to zoom your lens and don't just look at people at self-value. Don't look at institutions just on face value. Look deeper into them and see as a person, what do you really want to learn? Mentoring and being mentored is a continuous journey of the rest of your life. There's not going to be a place where you'd sit and say, I have achieved. If you've reached there, I'm really proud of you. But you really have to have a heart to learn every day, see the good in people, and bring out the best in everybody, even if it's not in the area of expertise that you're in. And through these programs and through these interactions that I've had with these different people, I have found myself being connected and taking mentorship as a moral obligation now, that whatever I learn from people, I have to transmit it to other people who I also encourage that they also have to have their own mentees, and those mentees should also have their own mentees so that the change should grow. And this is just one of the things that I talked about the multiplication effect. The people you see on the far left side, as I can see these slides, are the people who have pumped into me as all the knowledge they could. Are the ones I've highlighted in blue. Those are the formal mentors that I've had. But the other ones you see in red and brown, they're the people who actually saw the potential that I had not seen it myself. So they came and taught me and directed me the path that I should have gone. But then, for the ones that were not formally mentoring me, because I had a life purpose roadmap, I had to display to them and tell them that this is what I want to do. Where do I get from here to the next? And I can proudly say that I am here and what I am today and done all the research I've done because of all these people that you see on the left side. But then I also have to indicate that as a mentee, being mentored by these people, this was a relationship that was driven by me, not by them, because I knew what my needs were and I know where I want to get to. After getting all I got from them, I had that moral obligation now to pass on that knowledge to others. All these people you see in purple are people I have mentored. Others have turned out to be good mentees, others not. But it's something that you actually see that when I get out of the space that I'm in my research, I can confidently say that Raphael can take over the mantle because he's mentored over 8 people now. I stopped supervising undergraduate students. Judith is mentoring over 4 people now. The others have chosen other areas of expertise, which I respect. And I still get to them and check on them. Where are you? You said you're going to study HIV/AIDS. What is new in HIV/AIDS now? What have you discovered? Because I want them to become the best version of themselves. And one thing that, if there are any mentors here, one thing that we really need to watch out for is to force people to be us. We have to nurture people to be the best version of themselves. So if I'm a vector biologist and I'm mentoring people in sciences, if someone decides not to be a vector biologist like I am, I shouldn't hate them for that, but I should help them become the best version of what they are doing, whether it's in social sciences. If I'm capable of connecting them to someone who is able to do that, I should help them become the best social scientist ever in that area that they have chosen. That's what mentoring is all about. And I have seen us mostly mistaken that if I am a mentor, you also want to become exactly like me. That becomes a problem and it can also become overwhelming. And I've also seen some mentors forcing other people to become exactly like them. No, you need to give people a chance to become the best version of what they are in everything that they are doing. That's what I understand mentorship is, because we do better in things that we love the most. So in short, I would want to urge each one of us to have a sense of direction in our career. If you go to approach somebody to be a formal mentor or you're informal mentor, they will not direct you to a space where you do not know. You will need to have a sense of direction yourself as a mentee. And if you come to me as your mentor, the first question I'll ask you, where are you now and where are you heading to? Where are you going to be in the next 10, 15 years? And why are you doing what you're doing now? How do you plan to get to where you want to go in the next 15 years? So we start working in reverse. We start with the end in mind and coming back in reverse. So as a mentee, you need to play an active role. A mentor's duty is to guide you and not to babysit you. Most of us have destroyed mentorship relationship because we expect our mentors to do everything for us. We need to be, as mentees, to initiate this relationship. And that's the only way we get the best. Because trust you me, as you grow in these careers and you're building your scientific capacity, most of the mentors you have are extremely busy people. They only have an hour for you probably in a month. And if you do not make the most out of this hour and expect them to do everything for you, you'll still be where you want to be. So you need to have a clear sense of direction. In some cases, as you grow in your career, you also find yourself that you'll be blessed to have 20 projects at once. How do you choose the best project that serves you? How do you determine to choose the best path or the best job that serves you? Do you choose it for you or do you choose it because of the impact that you want to make? I'm available to talk about mentoring and mentorship at any time, but I think for today, I can stop here and get as many questions as I can. But I want to end this talk with this quote, that if you do not know where you're going, you end up anywhere, and anywhere can be anywhere literally. So you will need to have a sense of direction in your career. You will need to have a sense of direction in the science that you're doing and who it is going to impact. Thank you.
Dr. Elizabeth, thank you very much for sharing your story. And I should say it's very commendable how you have leveraged opportunities such as mentorship to excel in your career and also in your life. And what's more commendable, I'll say, is how you have also multiplied this effect to create a whole pool of mentors. So thank you very much. And with that said, now we would like to open the Q&A section. So there are a few questions in here. So we'll just briefly go through them. Okay, so I'll take a few and then Dr. Nzoma can take a few. So the first question is from Gladys, and it's asking how can we combine the female leadership to fight against vector-borne diseases and our social life? So I'll assume this is geared more towards a work-life balance. So I'll throw that to Ms. Gillian, yeah, or anyone.
Yes, thank you very much, Rosalia. I think the most key element is in planning. I think planning is very crucial. How do you strike a balance is very necessary so that you don't find yourself in a position where your social life is bleeding into your work life, or your work life is bleeding into your social life.
Mhm.
You need to make and manage time. You need to prioritize, and also not to procrastinate. Usually we find ourselves trapped in overwhelming and also overworked because we procrastinated, and now we are just having too much to deal with. So it is necessary for us to manage tasks, to manage time, and to also prioritize, but with adequate planning. Thank you.
Thank you very much. Then I'll take the next one from, oh, okay. So this is just a thank you from Ms. Bridget Shandukani to thank all the speakers for their wonderful talks. But then there's also another one that asks, how do we ensure that we are not discouraged as women by the environments that are not enabling and the lack of mentors in the male-dominated field? Over to you, Dr. Elizabeth. But please feel free for any of the speakers that would like to answer to the questions.
Well, thank you, Rosaria. It's really tough, I must say. And one thing that I've always told people is that when we are being taught about success and science and everything we do, we have not been taught of what it really takes to be successful. The journey in between is usually hidden from us. One thing I have benefited from is going through a lot of emotional intelligence trainings. And you really need to be self-aware of who you are, because trust me, when you're a woman, when you succeed, people find a reason for you. When you fail, people will also find a reason for you. So I must say, I agree with your sentiments that it's really tough. But one thing that has worked for me is you really need to be aware of who you are. Be aware of your social surroundings. Invest so much time in taking care of yourself and your emotional intelligence. It's something that grows with time, where you have to learn to talk without banging tables with time, because of how people would play with your emotions sometimes. Simply because you're a woman, nobody wants to listen to you. It really happens. But if you know what you're chasing after, or why you're doing it, these things will keep you going, no matter what happens around you. But it's a reality, what you said. So invest a lot in emotional intelligence. That has helped me a lot.
Thank you very much, Dr. Elizabeth. And before we move on to the next question, I see Professor Nkandu, your hand has been up. Did you want to respond also to the one on male-dominated fields? You having been the first microbiologist and the first immunologist, would you like to say something on that one? Okay, the hand is now down. Prof, are you coming on?
Thank you.
Okay.
Yeah, thank you very much. And that question is something that always comes up, and people want to know how you can deal with a male-dominated society. I think this is something that we need to accept, that you know, this is something that we're going to live with for a very, very long time. And as such, some of the ingredients that are important for the young people as they start shaping their future is the issue of mentorship, the issue of role models. Because when you interact with the role models, interact with the mentors, you will find that they will make your life easier because they will share their own journey, and you may see even yourself in that space. But I also believe that it's very important to make a decision yourself and say, this is where I'm going to be, regardless of what comes my way. And move that and be focused. And never get derailed because some other opportunity comes your way. That is what I think is very important. And I'll give you an example that I myself had to face with. And the reason why I think your own focus, the support from the mentors becomes very important, because you can fall back on them and say, here's something that has come my way. What do I do? I was recommended for professorship very early in my career because of the many things that I was doing, the publications, and so many things. But the dean that had recommended for me to be made a professor then had to leave and take up a job in the UN. And the next deans that came, two of them just wanted to sit on this recommendation. And regardless of the fact that I had so many publications, I'd done my contribution to various books and so on. But in the process, I would have actually given up and said, look, let me leave this and move and take on something else. But because in my mind, I had decided that this is where I want to be, and even put a time frame, I decided I'm not going to leave it to these men. I'm going to fight my battles and make sure that I get what I want. Even in the process, I was even offered ministerial positions by the president then. I just told him, I said, no, this is not where I want to be. This is where I want to be. So as much as you depend on mentorship, you depend on role models, we need to be inculcating in our young girls and so on for the word called focus. You need to focus. You need to make sure that you fight the battles, because it's not easy. And I know for a fact it's not easy. And this is why in my recommendations, I said we need to really get role models. We need, and I listened to the presentation for mentors, we need mentors. And these mentors may not even be professional, but just somebody you look up to and say, this will be my mentor and I'll follow their path. So the journey with the male-dominated society is not going to be easy, and we have to fight it at all fronts. And part of it is yourself, and say, this is where I want to be. And then you focus on that and don't get excited or be derailed. There may be some attractive offers along the way. If that's not where you want to be, make sure you get there. I also want to say something very, very important. Since I've had to live in both worlds of being a scientist and also a politician, for me, what I've observed is that it's so important to have in the political leadership people that are scientists, because science trains you to think, science trains you to be analytical, and therefore you not take anything just because it has come your way. A scientist, a scientific politician will always think twice, will analyze even all these dangles of carrots that come your way. you always analyze and say, if we take this country this way, what does this mean for this country? And for me, I think science is so, so important in our lives. And the more we bring girls and women to the science table, the better for the African continent.
Thank you very much, Prof. We are inspired, especially to hear from you, who is a leader in these fields. We have the next question from Marilyn Mae, and it's directed to Dr. Elizabeth. She says, please, how does a mentee know his or her limits with the mentor, sponsor, or coach so that one does not step on the other's toes? Dr. Elizabeth?
A very good question. Thank you, Madeline. I would not worry so much about a coach or a sponsor. I would worry so much about your limits with your mentor, more especially when you're a woman scientist and you are surrounded by males. I do not know what's the setup in other countries, but I can speak for Malawian scientists and some of the women that I have met across the globe who have also complained of how now being mentored, they start to be looked at as a threat. And then because you're a woman, I don't know, but in most African cultures where even in offices, women are looked down upon. One thing, and I must say that I've also experienced this, that sometimes being a mentee and you have a male mentor, they can take advantage of you. You also have to be aware of that. And I have had cases where I think 3 or 4 girls who changed mentors from having male mentors to female mentors because of issues of boundaries. I think I've had 3 or 4 cases of that. So one thing I would actually want to spell out is when you're going into a mentoring or a mentorship relationship with whoever is going to mentor you, male or female, the best case scenario is that you write your agreements right from the beginning before you even start to engage as mentor and mentees. And they have to be written agreements. And better when they've been written, there has to be a third party who can actually check both of you, someone who both of you can talk to. In my case, I think I had 3 coaches, depending on who I was dealing with or who I am dealing with. So you will need, as a person first, before you enter into any mentoring relationship with male or female, to be self-aware first of who you are, what you like, what you don't like, and if you're welcome to having feedback or not. Feedback is a gift that everybody would give you, but how they give it to you also matters on how you receive it. So I would say be self-aware of, if I look at Elizabeth, who is she? What does she represent? What does she want to be? That's the first thing. You will need to find a clear definition of that, what you are. And then when you meet your mentor, be it male or female, you have also to be aware of who they are. One thing that has worked well with me, like I'll give you an example. If I had a Chinese American mentor, Kerr, she is someone who would want to talk to you over a cup of ice cream. That's how she is. You want to talk about work and science, she'll take you to an ice cream park, you eat ice cream and you talk about science. You'd think it's just a chat, but I needed to be aware that, okay, when Kerr wants to talk to me, she wants to talk to me over ice cream. Other mentors would want to talk to you over a cup of coffee. Other mentors would just prefer an email. So you also need to understand who your mentors are. And one thing I did was to come out clear. In some cases, I faltered. In some cases, having learned of the mistakes I'd made, I had to start now to asking people that, I would like to send you an email. I want you and me to talk about this. Is this okay with you? And if they're not okay with it, I will not force it, because I have to understand that they're voluntarily mentoring me. They do not owe me. I am getting, if anything, I'm getting something from them. So you have to be aware of the kind of people that you're dealing with. And also, right from the beginning, set your boundaries right. If they tell you don't call me at 4, don't call them at 4. If they tell you, I'll answer your email next week, don't force it too much. And all this, I think, comes holistically with an issue that I talked about, emotional intelligence and being self-aware and the leadership skills and everything that we've talked about earlier. You have to mix all this up to interact with a mentor. It looks simple, but it's not simple at all. And it's a process that both of you have to go through. And I have to say that mentoring relationship should not be forced. If you see that it's not working, it's okay to say that. I really wanted you to be my mentor, and I'm grateful for all the guidance you've given me, but I think this is where I stop. It's also all right. And that's something that most people don't want to talk about also. So if you see that the mentoring relationship is not working with you, or it's getting you in a space where you don't want to be, it's also okay to say, hold up, and think this is where I stop. I appreciate moving forward. I promise you I'll get this done. When you hear that I've achieved, you definitely be part of my story, and I'll update you when it's necessary. It's also okay. But I think in our culture, we've not been taught of how to express yourself and tell people how we really feel. Yeah, so that's one of the things. I'll give you an example. When I finished my school to come back to Malawi, my mentor, who also played a supervisor role at some point, said, Elizabeth, you have to come back to the States. It was a very difficult thing for me to choose. And she said, if you're not coming back, we're going to do some other things and we'll take you out of some of our projects. It was really hard and tough for me to work with that. So I think Prof has talked about the politics of science here. I had to let go of a publication in Nature because I wanted to work in Malawi to get some of the things done. But this did not mean that I hate my mentor. But what I had to do is to tell her that, oh, I appreciate you giving me this opportunity. Since you're now working in global health, we'll meet. You're not in Africa enough, but when you want to come to Africa, I'm okay working with you. But this is the kind of relationship I'll have with you moving forward. So you will step on people's toes, mentors will step on your toes, but the most important thing is you need to know who you are, what you represent, and what you want to achieve, and where you're heading to. That's the most important thing.
All right. Thank you so much, Doc. I'm sure we all have burning questions, but due to the limited time we have, please just put them in the Q&A and we'll find time to attend to all those questions. For now, I'd like to invite Dr. Jessie Gopeyo from PAMCA to give a brief overview of the Women in Vector Control Program. Over to you, Dr. Jessie.
Thank you, Rosalia. Let me share my screen. Can you all see my screen?
Yes, it's visible.
All right, thank you. So good afternoon or good morning, everyone, depending from where you are attending. So I'm Jessie Gopeyo. I'm one of the Women in Vector Control Regional Coordinator at PAMCA. So I will give you an overview of the PAMCA Women in Vector Control Program. So as a background, as most of us here, we know the reality of vector-borne diseases in Africa. So, and millions of individuals suffer from these diseases, experiencing debilitating symptoms and long-term complications. And as some of you know as well, children, pregnant women, and those with weakened immune systems are especially susceptible from vector-borne diseases. And the impact extends beyond individual health, affecting families, communities, and national economies. And vector-borne disease can also contribute to lost productivity. Like, for example, when you are sick, you are not productive as when you are healthy. We also have decreased school attendance and further limit access to essential medical care for many of people who are suffering. And this ultimately hinders development efforts and perpetuates a cycle of poverty and ill health. And our journey now begins by recognizing this complexity. Why gender in health matters. So good health and well-being is at the heart of the United Nations 2030 Agenda for Sustainable Development, that is achieving gender equity as a prerequisite for sustainable development goals, including gender equity, reduced inequalities, inclusive societies, and strong institutions. And this argument is based on effectiveness and representation. Why? Because issues facing our society and health today are very complex, and there's a need for diverse workforce and talents for effective solutions. And we also know that following even the previous talk, that women are more likely to consider a broad range of needs, interests, priorities for all in societies. Now, this graph represents the proportion of women researchers in the world, data from the UNESCO. As you can see, among the students, the graduate students, women represent 53%. We can say, wow, this is good. But as a woman is growing in her career, we will see a lower proportion of women, leading to only 28% of female researchers across the world, which is really bad. And role of gender in vector-borne disease control. Gender equality and women's rights are critical drivers of health, well-being, and socioeconomic development. Just to take a few examples, for example, when you go in our communities or given the way the household or the families run in Africa, the mothers usually are the one who understand better the children when they are sick. When they are sick, they are the one who make sure that the children take the treatment, and also that the vector control tools they are implemented. And now the complexity of global health problems demands leadership that represent the pluralism in society, meaning that even at the decision-making level, we also need to have more women represented, and to reach a point where we talk about leaders, not only leaders as a previous speaker mentioned. Here I'm referring to Malatje. So it's therefore important for African-based institutions and all women allies to take deliberate steps to put in place programs that enhance women's participation in vector control and elimination initiatives. It is towards this aim that the Pan-African Mosquito Control Association established the fully fledged PAMCA Women in Vector Control program that aims at strengthening the role of women in the control of vector-borne diseases, with the primary outcome to have African women with skills, confidence, and support to access opportunities for advancing their career in vector control, further contribute to sustainability in the vector control and elimination programs in the continent, with an Africa free of vector-borne diseases. I would like to highlight here the unique position that PAMCA has, because it plays a pivotal role in addressing these diseases in Africa. From idea to implementation, here I would like to spotlight the person without which we wouldn't be talking about women in vector control program. So for those who do not know, Dr. Damaris Matoke Muhia is the person who had these brilliant ideas. She's the PAMCA program manager, capacity building and gender mainstreaming. She managed to convince the Bill and Melinda Gates Foundation to provide funds to implement these activities. So, and I would like to say thanks again, Damaris, for this brilliant idea. And the Women in Vector Control program was launched in 2019 during the 6th PAMCA annual conference held in Yaoundé, Cameroon. We can see here some pictures that were taken during the event, and it's that time that we actually had the first workshop. And that first workshop really showed how, I would say, women are suffering. Because I remember I attended that workshop, a lot of women crying. They felt not understood, and the problem is deep, more than what we can think. And for more impact, we as regional coordinators were brought on board in 2022. So we are currently 3 women in vector control regional coordinators under PAMCA Women in Vector Control program, including myself, who oversees the West African region, Rosella Joseph, one of the moderators of this webinar, who oversees the Central and Southern African regions, and Christina Sudi, who oversees the East African regions. PAMCA Women in Vector Control has several flagship activities, including capacity building. So far, we have conducted several training courses and workshops on leadership, some specialized skill-based courses, including, for example, safeguarding workshop that was held last year during the PAMCA conference in Addis. We also had an effective communication workshop that was held in Rwanda, and between the conference, we have online trainings that we also provide. So apart from capacity building, PAMCA Women in Vector Control also has a Lift Her To mentorship program, which is a mentee-driven, mentor-guided program. I really like the talk of Dr. Bandason, where she highlighted the role of the mentee, like the mentor should go to the mentor, which is very important. And that's one thing that we really focus on the Lift Her To mentorship program that aims to empower African women leaders. Another flagship activities is the visibility of African women in the control of vector-borne diseases in Africa. Through this, we have the Excellence Award of Recognition, where we recognize the contribution of ladies across the continent. And we also have the Travel Awards that allows women who cannot afford to attend the conference and to come to the conference and to present their work. Other activities include networking, collaboration, partnership through the different PAMCA Women Vector Control chapter initiatives. We also have a Women Vector Control online community, including we have a WhatsApp group, we have our social media platforms, and we also have a microsite that is under development and will be shared with you soon. Another aspect of the program includes gender equity and creation of an enabling environment for women, where the goal is to integrate topics and discussions in meetings within PAMCA and also with partner institutions, and also to implement gender inclusive policy. Also at PAMCA to start, and also in all partner institutions. Last, but not the least, the women or non-professional women are also considered in the program. So we have variety of activities where we foster the engagement of women at the community level, also school outreach activities on vector control. So I will stop there. This is briefly what is the PAMCA Women in Vector Control program, and we are available on Facebook, LinkedIn, and Twitter. Please go and follow our page to not miss our update. Thank you, and over.
Thank you very much, Dr. Jessie. Just to give a wrap up before I call upon our speakers to give a last word each, is we saw that our three presenters spoke from the perspective of their own experiences, and this brings out the reality for us as women and girls in science. Prof. Luo showed us a difference between public and global health and how global health comes to our context, our environment, talked about culture and gender, and how these cultures, rich as they may be, may also bring challenges. And we have seen, especially for us women, being sidelined because of pregnancies and breastfeeding and such as challenges that we meet. So she stressed the need for empowering women, and also for us to come up with policies in line with this. And I think Women in Vector Control is doing well in this regard. Ms. Gillian showed us what leadership is, and she brought it in the context of malaria control. She gave us the key attributes of women, such as we are focused, we have empathy, we are humble. And she also talked about leadership being teamwork. So leaders must see their people as a team. And for some do's and don'ts, she said we must be visionary, we must have a system. And for some don'ts, she said we must not micromanage, but let each one be a team member, independent, but yet adding to the team. We must not discriminate as well. Dr. Elizabeth Bandason talked about what mentorship is and also what it is not, and how it is important for women if they should achieve their goals in science. So she brought out the role of mentorship in science. She also brought out the multiplicative effect. We saw how she has been mentored, and then she's mentoring others, and they are also mentoring others still. And the last was that she recommends for us to have a roadmap if we are to be successful in our mentorship. So with that, I'll just ask in the same order that they presented for them to give their last words under a minute each. Prof. Nkandu, you'll go first, then Ms. Gillian, and then Dr. Elizabeth. Thank you.
So thank you very much, Madam Moderator. I think my last words is first of all to commend yourselves for this initiative. And I think all of us must support this initiative. And I looked at your activities. I think they are spot on, and they can contribute greatly to encouraging more women to participate in science. And I think one of the things I would like, as I did recommend, is for us to start putting together role models that the young people, when they are deciding on their career path, so that we bring in more women in the science field. We need this role model. And maybe you may consider even doing a book. I've seen who is who. Maybe we need to write something and document who is who in science, so that the young people can be inspired and use this as a stepping stone to a decision to get into the various careers in science. But most importantly is for us to address the challenges that face our young people, young women from the time they are young, all the issues of policies, the issues of child marriages, all that, they impede the prospect. Because by the time you now decide now to come and use the concepts of role models, concepts of mentorship and so on, it's they say charity begins at home. So what programs are we going to have as a team to ensure that charity begins at home? We attract more young people to get into science. We keep them in schools for them to be able to enter the tertiary education, universities and colleges. Thank you so much.
Thank you, Prof. Ms. Gillian, you can please go ahead.
Okay, thank you so much, Dr. Nzuma and Rosalia. And again, to thank PAMCA for such an honor and such a great initiative. I believe that as women, we are capable of defeating the gender disparities and the discrimination and the stereotypes that are there. And we can really do it. We can uplift each other, we can support each other, and we can carry each other and be each other's coach and mentor. And just to encourage PAMCA to reach out and collaboratively with the different countries, so that as women, we can be able to get into the space and to inspire other new young people, and also to change the status quo. I think that is very important. As we have seen, the percentage is very low, and we need to work hard and collectively to change the status. Thank you very much.
Thank you so much, Dr. Elizabeth.
Thank you so much. I think I would summarize it this way. It's an interesting journey to be a woman scientist. You're going to meet a lot of things on your way, and that are going to make you feel so afraid, less of yourself. People are going to challenge you. Others will create stories for you for being successful. Others will look down on you for failing one thing. But I want to ask each one of us not to be afraid to do the unfamiliar things in science. I would leave this conversation with this statement that you can feel the fear, but do it anyway. Because if you don't do it, no one is going to do it for you. Thank you.
Thank you very much, Dr. Elizabeth, Professor Lua, and Ms. Gillian for those encouraging words. I'd like to believe that each one of us here today on this webinar will not leave empty-handed, and the hope is that whatever information that we took away from this webinar, we will indeed share it with others, or either use the skills to replicate some sort of effect that can be impactful in society. I'll just like to ask our esteemed speakers to briefly put on their videos, just for a quick snapshot. Professor Lua and Ms. Gillian. Dr. Jessica Peo and Dr. Nzama. I think, Jessica, can you please help? I think I'm having some technical issues in terms of snapping the whole screen.
Okay, let me do it.
All right, and
although we can't see Prof.
yes, I think Dr. Gopeo will sort that out. Hopefully.
I'm told you have muted me, but I've got my video on.
Sorry, Doc.
Oh, but it's dark. Yeah, it should be. Okay, let me take another one. Good. We are all beautiful.
All right, thank you so much, Gopeo. So ladies and gentlemen, we have come to the final part of this webinar, and it is with so much pleasure and honor that I'm welcoming Dr. Damaris Matoke Muhia, who is our pillar of strength and leader in this fight against gender disproportionate within the field of public health and vector-borne diseases. Over to you, Dr. Damaris Matoke.
Thanks a lot, Rosalia. Hope I can be heard.
Yes.
It's amazing. I think this has been an awesome webinar. Every minute our speakers were talking, I kept on feeling like we need more of the same. Mine is not to say much, but it is to call upon all of us to walk the journey with us, to support. I'm not here meaning to support PAMCA, but to support that girl child around you, to support that colleague who's female around you, to support that woman in the community who's trying to do the best they can to prevent vector-borne diseases or to address issues concerning health. PAMCA is thrilled to strengthen the role of women in the continent in the fight against vector-borne diseases. And we are happy to be working together. The team here, I think I saw a good number of people attending the webinar. We've discussed issues around capacity building, believing in self, issues to have where mentorship, issues to do on what needs to be done, the do's and the don'ts, and hearing the experience, especially from Professor Luo, being both a health professional and a politician. The desire for us as PAMCA, the coordinators ourselves, the PAMCA management, is to see more women occupying spaces, more women being leaders, more women taking the lead or championing, because what I believe in is that we do our work very well. And when we do it, it affects the community positively. So if we don't sit on those decision-making tables, if we don't sit in areas where we can impact of gender lens can be applied in designing of tools, in implementation, then we are doomed. So it's important that we empower everyone around us so that we are able to ensure that this continent changes for the better, especially on issues to do with health. I call upon all of us. Thank you, our speakers. I feel that, Rosalia, you need to organize another one so that we hear more, also that we engage more together in ensuring. The other component I needed to bring on board is the component of male allies. The thoughts of what we are doing is not to remove men from the equation. The thought is to bring ourselves to the equation, because we've been living in a male-dominated world. So we bring ourselves to the equation so that we work together with with our male colleagues, we work together with our male leaders. We are not going to change the world overnight, but to work with them till they get to realize, oh my God, these areas that we've been neglecting, these women that we've been underlooking, how can we work with them to make the world a better place to be, and especially in the fight against malaria, and more so in empowering the community on other issues around health. So thank you. Mine is just to say thanks a lot for attending, and also thanks a lot to our panelists. Looking forward to get in touch to see, especially during our Women in Vector Control program.